Healthcare organizations are really struggling to keep their doors open. Any opportunity that you can have to generate more revenue is a good one. The fact that you can not only do something so incredible for your patients, but get paid to do it, it just makes it a win-win for everybody.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster, here with Nicole Cook, the CEO and founder of Alvee Health. Nicole, always good to see you.
Good to see you, Logan.
So the last time I saw you, you had just won a pitch competition at Health, and you were carrying
Sure did.
around a giant check.
Yep.
So, first I have to ask, what did you do with the check? Where does one store a 4-foot wide check?
Well, let me tell you, getting that check home was quite the journey. Imagine going through security at the airport and then actually carrying it with you on the plane because you can't really check something like that.
It's literally
pun
like 5
intended.
feet wide. It's literally...
It's huge, yeah. It's
Yeah.
bigger than me, as a human. So I had to kind of be really friendly with the flight attendants, and they were kind enough to store it in a coat closet for me. And
I love it.
But now it has a very prominent and lovely spot in my home office,
Nice.
where it can be displayed for all of time.
All right. Maybe visible on a Zoom call even.
Yes.
That's great. So, how did you win the pitch competition? How did you get the big check? What is Alvee that you've built?
So at Alvee, we're on a mission to help to reduce health disparities and improve health equity. And, I think during the pitch competition, what really resonated was just the idea that, not only are we very, very mission-driven, but there's also so much great sort of momentum behind it in terms of the policy support and also now the reimbursements that are available.
Okay.
That's been a game changer, honestly, in all of my conversations. The fact that you can now get so much additional revenue from doing social needs assessments and spending time addressing unmet social needs makes everything that much more feasible for organizations. And I think that, and especially just given the current ecosystem where healthcare organizations are really struggling, to keep their doors open. Any opportunity that you can have to generate more revenue is a good one.
Yeah.
So the fact that you can not only do something so incredible for your patients, but get paid to do it, it just makes it a win-win for everybody.
Okay. Well, let's drill down on exactly what's changed policy-wise. It's a really interesting angle because for so long, the folks who said, "Oh, we need to be thinking about the other aspects of a person's health and life," they were doing it because it was the right thing to do, and they weren't making any money. And now you're saying the stars are kind of aligning. So tell me about what the regulatory changes have been.
Yeah, absolutely. Well, I can't take credit for this phrase, but I've heard it from others, and I really like it. No money, no mission. And I think that really sort of fits in strongly with what we do at Alvee. But in terms of just the regulatory requirements, there's so much emphasis now on managing health disparities and identifying social needs and improving health equity at an organization. For the reimbursements in particular, there's a bunch of new codes that were included in the final physician fee schedule from CMS.
Okay.
So that went into effect on January 1st.
Of this year?
Of this year.
Okay, just a couple months ago.
Exactly. So the first one is that they're reimbursing for social needs assessments.
Okay.
And then there's sort of a second grouping or category of codes, which is all really related to the time spent addressing unmet social needs.
Okay.
So essentially, once you identify that someone has a barrier to care or some sort of resource need, you can have a visit that is completely devoted to just working with them on getting them connected to resources.
And you can get paid for that.
You can get paid for that.
Get reimbursed. Wow.
Yep.
Okay.
And so, this was in CMS's final physician fee schedule. And so what that means basically is that it's now been adopted for all of Medicare. However, most lines of business will follow the final physician fee schedule. So, for example, with Medicaid plans, it's going to be state by state. However, most Medicaid plans also follow the final physician fee schedule from CMS.
Okay.
So the only difference is that generally they're going to reimburse it at a slightly lower percentage than Medicare. And then as far as commercial plans go, again, they usually follow the lead of CMS for these codes, but it could be a little bit more variable in terms of when they add it to their individual fee schedules, because each provider negotiates rates sort of individually.
Okay.
It's confusing.
Yeah.
But a long-winded way of just saying that, okay, even though this was sort of introduced by CMS and it is in effect for Medicare, all of the plans are adopting it.
Wow.
So it's not just sort of niche populations, but it's for everyone.
Okay. How quickly is the market responding to those changes? What are you hearing from folks? It's not like a nozzle turns on the minute the regulation changes. How are you seeing people sort of line up to make shifts in their own policies?
It really varies across organizations. A lot of people have started to adopt social needs assessments, even as of like last year, some even earlier than that. But for one organization that we're working with, they've been doing social needs assessments, but even though the codes went into effect on January 1st, they're not billing them.
Okay.
So they're losing out on this revenue.
Okay.
And so one of the cool things that we've been working on at Alvee is automatic charge capture.
Okay.
So not only can we help to like codify these things and provide the tools, to take advantage of getting these reimbursements, but now we can also auto charge for them so that you're not missing out on that, newly available revenue.
Now, a lot of what we just discussed has been kind of under the hood, reimbursement regulations. I want to kind of put a face on it and talk about what it's like for a frontline caregiver to do a needs assessment with a patient, and kind of what that looks like with Alvee and what that means for both of them as humans, to be able to do that work.
Yeah. In the current state without Alvee, it's, if you have a social needs assessment, you're going to do it in your EHR, which is a good idea. But the problem is that it sort of just doesn't really go anywhere. It's hard to sort of like go back and reference like that information. And it's hard for other members of the care team to see that information. So if you've identified, an actual social need, then it just doesn't really come across, to others.
And just remind us what some of those assessments might be, just to educate the audience.
Sure. So it's really around understanding, what is your economic situation, how many people are in your family, like where do you live, like what kind of housing do you have reliable transportation, are you eating enough food, like are you able to put food on your table. So it's really all related to the social determinants of health, spanning sort of like these major categories.
Okay. So in the old way, either you didn't do it, or you did it, you didn't get reimbursed, or you did it and it just wasn't, the data wasn't integrating. Now through Alvee, how is the patient's life different now that this is being captured in a new way?
So not only are we helping to automate a lot of the workflow by not only helping with the assessment, but so we can help to mitigate situations where you don't have time to do a full assessment.
Okay.
So for example, we use predictive analytics to proactively identify these different social needs. So we're able to, predict ahead of time who has food insecurity or who has transportation challenges. But not only that, what's really exciting is the work that we've been able to accomplish with Mayo Clinic Platform Accelerate. So we've built an NLP algorithm that can now also find references to social needs in unstructured data, like clinical notes, doctor's notes, or these assessments, where it's like in an assessment or a flow sheet, but it's not codified, it's not structured.
Okay.
So we automatically structure the data by tagging or attributing it to an ICD-10 code.
Okay.
So basically, all that to say that we now have the ability to leverage this data to search for it and to present it to other members of the care team, but also to bill for it too.
So previously, locked up in some record was a note that said so-and-so might have trouble making it to an appointment because they don't have a car. So-and-so isn't able to get the food they need to address their type 2 diabetes. But it was just in a note somewhere, hadn't been structured, hadn't been really assessed anywhere.
Right.
And you're able to bring it into a global system.
Exactly. And not only that, though, it's like now that we have this data, now that we know that someone has a problem, what do we do about it?
Yeah.
So that's also where Alvee really helps, is that we make it actionable. So not only do we provide the tracking and the management tools, but we're developing personalized SDOH care plans.
Okay.
So based on the health condition of the patient and their social needs, we automatically create these interventions and recommended resources, all with AI.
Interesting.
And then from that, basically, what we're working on this year is an autonomous care navigator that will actually execute on the care plan and help to ensure that patients are getting connected to resources so that we can close the loop on the resource referral itself.
Okay.
So it's, incredibly exciting stuff that we've been able to accomplish in the last several months, but also, the way that we're going to be able to scale SDOH initiatives in the future is quite mind-blowing.
Yeah. What kind of reactions are you getting from the doctors and nurses that have gotten to use it?
We've gotten a lot of really good feedback. It's, we've really intentionally tried to figure out how do we create tools that are going to work for them in the workflow and
Yeah.
not disrupt the existing workflow, especially because, actually capturing SDOH is sort of a newer thing. It's not like,
Yeah.
they've been doing this forever, although, there's been times where they'll mention it in a note, but not in a structured way.
Yeah.
So again, it's like, well, you can continue to do that, but we'll just pull it out automatically for you.
Yeah.
And I think that, like, the users really appreciate that perspective. And, I think, again, like, my time at Epic really showed me sort of, how important that workflow integration is. So the fact that we're embedded in the EHR, the data is real time, it's single sign-on, everything flows really seamlessly back and forth is just such a big value add. But then also, like, the fact that we're trying to automate so much more of the workflow is incredibly important because they don't have time.
Yeah.
No one has time to do these additional things or document more things.
Yeah.
And so, wherever we can, we're figuring out, like, how do we reduce clicks? How do we leverage AI to, make the workflow easier, faster? And so not only are we leveraging, machine learning and NLP and generative AI, we're also, looking at just sort of like all of this together, like how do we sort of like use it in concert so that it's just like a really frictionless sort of like introduction of SDOH. And at the end of the day, people want what's best for their patients. And so if they can accomplish that without having to like take on so much extra work, they want to do it. They want to do what's right for their patient.
Yeah, that's good. I think the first time that we talked, when you first joined Startup Health, you talked about how your time at Epic was, you consider that part of your superpower. You already understood how to integrate.
Yep.
And over the last year, has that sort of borne out? How have you sort of shaped the product based off of that unique experience?
I think it just, it's always been a foundation to Alvee and like how we've developed it from the ground up. On the back end, if you want to like open up the hood and see it, like kind of how it's working or how these integrations actually like we make it possible, you'll sort of see like that sprinkled throughout.
Yeah.
But it's really just about sort of understanding the data model, understanding like how information flows back and forth between our platform and to an EHR system. And I think that unfortunately for a lot of folks who are building technology in healthcare, EHR integration is usually like it's like the last thing they do.
Yeah.
It's sort of the afterthought. With Alvee, it was the first thing.
Yeah.
We knew that in order for this tool to be something useful and adopted, it had to be in the EHR, in the workflow.
Yeah.
Otherwise, forget it. I mean, it's just too much work. So I think it remains the superpower, and I'm here for it. But I think I attribute a lot of just like the success of like how we can integrate into the workflow, to that experience.
Yeah, it speaks to the firm foundation of the company and your ability to create a moat and like a strong value proposition going forward as you continue to make integration a priority. So Nicole, thanks for coming by. I appreciate getting the update from the last, the big check conversation, and it looks like 2024 is going to be, a big year.
It's going to be great.
An inflection point for Alvee as you keep growing. So it's going to be exciting to watch.
Yeah, awesome. Thank you, Logan.
So congrats for everything.
Yeah, thank you.
Take care.